All right. Hi, everyone, and welcome to today's WALPIN webinar. I'm Marcy Hubbs. I'm the manager of Well Ahead Louisiana Provider Education Network, or what we like to call WALPIN. And I want to thank you so much for joining us today. So first, I'd like to go over some general information regarding the webinar. First of all, this webinar will be recorded and posted to www.walpin.org following the presentation. Also, an email including the link to this recording and all materials presented during today's webinar will be sent to all that have registered. This email will also include a brief evaluation, so please take the time to provide feedback to help direct future webinars. And if you have any issues during the webinar, please type a message in the chat box and we'll do our best to address this. So please hold all content related questions to the end of the webinar. We will have time at the end of the presentation for Q&A. And at that time, I'll have you type questions in the chat box for us to address. So WALPIN is very excited to bring you today's topic. It's regarding tobacco use trends, cessation, and resources for providers. So we have experts in the field here to bring us the latest information and resources available. So I'd like to introduce today's presenters. We have Dee Dee Raxworthy. She has worked with the American Lung Association for 11 years and currently serves as National Manager for Tobacco Grants. She's a certified tobacco treatment specialist, and Dee Dee has extensive experience in training providers in making sustainable systems change and has assisted in expanding tobacco use and dependence protocol implementation within EHR to provide consistent, sustainable treatment and improve patient outcomes. Dee Dee has provided assistance to providers in various healthcare settings, including FQHCs, community clinics, and behavioral health clinics. So we're very excited to have such an expert in the field. And we also have Taylor Wren. She is with Well Ahead Louisiana and serves as our cessation coordinator. She serves as the subject matter expert for tobacco cessation across the Bureau and supports Louisiana Tobacco Quitline to promote tobacco cessation and raise awareness of available quit resources. We're so lucky to have them share their knowledge and experience with us today. So I will now turn it over to Dee Dee to get us started.
Thank you, Marcy, for that very kind introduction. And Taylor will be coming back later to talk about all the great Louisiana resources that are available to you. This presentation that I've created, I decided to call Tobacco Cessation and Health Systems Change, diving into the Million Hearts Tobacco Cessation Change Package. There's a little bit more to it, but before we get forward on that, I do want to declare that I have no relevant conflict of interest. My work now, that is new as a national manager for tobacco grants, the grant that I'm working on is a CDC grant from the Office of Smoking and Health, or OSH, which the Louisiana team is well aware of also. So 2 major goals. I just want to help to make everybody get on the same, what I say, really kind of talking some of the same terminology, getting back a little bit of nicotine addiction, just because it's such a big issue right now and coming to the fore, especially with e-cigarettes. I have a quick ask, advise, refer to quit, don't switch practice thought process that might work for some of you in your clinical practice. I do have a couple of resources for the ALA that might be helpful. And then I'm also then going to go into a deeper dive with this Million Hearts change package. So the first slide, you've probably seen something similar to this many, many times before. We usually do start, obviously, when we talk about smoking or any kind of other tobacco use, we are talking about nicotine is the common substance in all of these products. And what we're talking about is, how does this nicotine get into the brain and what does it do once it gets there? And again, I think a lot of you will know about the different pathways, the tobacco receptors, and other things such as nicotine priming the brain for other substances. There is data, very strong data that show, it was done with rats, but it still is relevant, that rats who received nicotine for a while and the brain changes had occurred, their brains were much more receptive to cocaine. So this is why we oftentimes see nicotine or any kind of smoking of some kind or tobacco use, along with those dealing with other substance use disorders. The nicotine, if you will, has come along for the party. It does help increase the high. And I just want to also say that with smoking, first, that's really the fastest way to get the nicotine to the brain. If we look at the gum, which is pure nicotine, that's a pretty quick way. It's also because it's parked in the metacusal of the mouth and the cheek. And third, just for the sake of conversation, is the patch, which is the slower of, if we want to talk about combined pharmacotherapy with the patch and the gum. So taking the nicotine ideas of what it does to the brain and understanding treatment protocols, if someone's been put on the patch and they have bad dreams, they might take the patch off at night, which is okay, but realize they'll be nicotine starved in the morning. And that's where the gum will come in for any of those first morning cravings and other breakthrough cravings during the day. So the physical is the one thing, but we also have, of course, and this makes it a little bit more difficult dealing with smoking, especially if you're in a medical healthcare provider organization, is that we're dealing with the mental and the behavioral. So here's just a slide that talks about some of the things that you can do to help work in some of this thought process. Now, a lot of people don't have a ton of time with their patients. I'm fully aware of this, but sometimes picking a few tips and techniques can help breeze through and also help your confidence with treating tobacco use and dependence. And the same works exactly for all of our emerging products. We call them e-cigarettes, we call them vaping, we call them all different kinds of things, but anything with nicotine in it, it will serve the same thing, because there's also the mental side of things and the psychosocial. So just a little quick setup here with e-cigarettes, just to kind of bring everything into focus here. I know you know a lot about them. They've certainly been in the news. I am not going to speak much about the lung illness situation or what the CDC calls EVALI, but if you have some questions about that, you can put them in and ask them at the end, or we can get back to you. But in the day-to-day, in your day-to-day world, you're dealing now with people who smoke, but the question it asks needs to also include other things. And e-cigarettes, they are a tobacco product, not because they have physical tobacco, dried up leaves in them, but because nicotine is really the tobacco plant's own herbicide. So it's a poison, it's on there naturally. So anytime you find nicotine, then it is related to the tobacco leaf. It's a pretty nasty product to have to farm. Nicotine is a poison, and you can read here of what the FDA says as their definition. So just for some interest, there's always something new coming out. Some of you probably already know about the jewel pods that come along with a sweatshirt, so you can hide the pod and put the connection into the computer and then run it so that you can keep it going. And that's really great for kids who are trying to hide it. And there's a watch, which many of you may have seen. There is also something new on the market. It's only in Atlanta right now in some sort of high-end mall. This you may have heard about before. It's IQOS's I Quit Other Smoking. The whole idea what is that this product doesn't contain as much nicotine and it's not a combustible. So it's sort of in between the whole vaping idea and an actual lit cigarette. The issue with this, however, is that it's jazzy again, like Juul was. It has that Apple Store feeling. It has that Apple packaging, which Juul had. And this could be the next product to be paying attention to. So it is of note here with any of these e-cigarettes and all of these different products, many started out as smaller products, but the larger tobacco companies have purchased them all. So when they used to call young kids or youth replacement smokers, they found a way to replace the combustible cigarette with all of these other non-combustible type products. And this is, of course, a huge concern. You all know about that. Again, we've now got IQOS that might come into the market. So just to quickly to get everybody on this conversation, because so much of the messaging, and again, this is marketing, like vaping, it's a vape, it's water vapor. Well, no, it's not. Think of it as an aerosol. That's a little bit easier to understand and might be a word to use with your patients. Yes, it is safer than a combustible cigarette, but it is not safe. And I think that's where a lot gets lost in the translation, especially with youth and others who have started on this because they listened to that early messaging where it was safer, but they never got the not safe. And so we have now this new group, young kids really taking this on, and we also have our smokers trying to use this as a cessation device, which I'll get to in a minute. All of this worries me. The diacetyl, the chemical linked to serious lung disease, that's from a lot of the flavors that are now being banned. However, we still have mint and we still have menthol. The ultrafine particles are things that we see in air pollution, but it's not something that we see in higher dosages from a normal everyday world of any of our patients. And because they're so ultrafine, we're not exactly sure what all they're doing inside of our lungs. This also brings up the whole thing of nicotine salts, which is used in Juul, which we know at least one nicotine from the amount of nicotine from one pack of cigarettes equals 1 Juul pod, but it may equal more because nicotine salts, again, are something that is a new derivative and there needs to be more study. So this just hits the fact that we probably all know somebody who quit smoking cigarettes. We get that anecdotal information. They've quit their cigarette smoking by using some sort of e-cigarette product. However, the overwhelming majority of the data is showing that they become dual users. So they use in this case, we've got a picture of a Juul when they're inside, when they can't smoke openly versus the regular cigarette when they were always smoking anyway. So they're perhaps getting a lot more nicotine than we think. And this is obviously a real problem because we're undoing that message of it's safer than a cigarette, but not safe. So here's some e-cigarette resources for you. And I also have some emerging trends because this is a moving target. I wish I had all the answers to all the questions that need to be dealt with these emerging products, but we're all doing the best that we can to come up with the data that we need. Now, some Quitlines are offering counseling and NRT to e-cigarette users, and I think that data will become valuable, hopefully sooner than later, once they work out the protocol of figuring out the amount of nicotine and then what should be prescribed for nicotine replacement therapy. So just a very quick, we all have heard about the 5 A's. This was the book that I got 11 years ago, and I was told to read it. So we've been stuck in the Ask, Advise, Assess, Assist, and Arrange for many, many years. This came out in 2008. And I don't mean stuck in a bad way. I think that's still a good guidance tool. But as we continue to improve that arena for treatment for our patients, we're also looking for systems level change. And this is the precursor to the next section. So system strategy 1 is the 5 A's. System strategy 2, I lifted this right out of the book. It's providing adequate training, resources, and feedback to ensure providers consistently deliver effective treatments. So a lot of that is about consistent and sustainable across the whole healthcare organization. And systems strategy 3 is dedicated staff. Now, oftentimes this might mean that the, let's say the diabetes coordinator is also trained in helping with cessation. Or it could be that you have some tobacco treatment specialist amongst your team. They may already be a part of the team for assisting with the overall systems change. There's also Freedom from Smoking, which is a resource of the American Lung Association for people. There are a number of different programs out there for training, but trying to get that in-house so the referrals are in-house instead of sending them off someplace. Okay, so ask, advise, refer to, quit, don't switch. The only thing about ask is here within electronic medical records, or also if you're in a behavioral health or a mental health provider, you may not be using EHR yet, so put in the workflow, into the treatment plan. We need to add in the language of all of these other products, because it often is, do you use e-cigarettes? No. Do you vape? No. Do you Juul? Yes. So the complications here, this is a section that I'm trying to work with the CDC and other experts around the country to get some really good screens to improve on what the ask is right now. Advising is always being specific. This gets into something that we call the quit, don't switch, which gets into that terminology of using a vape product of some kind instead of quitting tobacco in the first place. And we know that there's always a quit plan. If we have counseling and medication, the outcomes will improve. So we do know we take a clinician, we take counseling, and we take medication, and that's where you will get the greatest efficacy of quit dates and staying abstinent. So here's just a couple of basic charts to share with you for the advice. So when you're trying to meet your patient where they're at, they may be coming in with these other issues. You may be a heart specialist. You may be working in some of these areas in these specific tracks. So you're probably a little bit more comfortable with some of these, but it does give you an idea of some of the different kinds of questions and answers and conversation you can have with your patients. Diabetes, cancer. So again, some of these you probably are a little bit more comfortable with and understand. I do want to make the point with diabetes because we do see this issue of diabetics and smoking, and it's a very bad combination. So nicotine, again, getting back to that, does interrupt the system that allows for blood sugar regulation. So diabetics who are smoking are going to have sort of a negative outcome, if you will, within their work at trying to keep their blood sugar normalized. There are also the decreases in complications such as blindness, reducing the chances of amputation, and improved blood flow. So nicotine, because it affects those other systems, also then mimics what diabetes does within the body. My brother has diabetes, and everything that he's dealt with would go on the same list as a heavy smoker. He's had a heart attack, and he's having eyesight issues and all the other things that come along with it. So here we go, 4 stages of life. How about what really resonates with teens? What about those who are pregnant or in the perinatal phase of life, parenting, and older adults? It's never too late to quit. And here's our e-cigarette and vaping. So this is about a treatment plan of some kind. It's an example. Everybody's looks different, but I do want to make a powerful push for referrals to the Quitline. You'll be talking more about that later, but because they can offer counseling, then that's a great way to kickstart this work, depending on how much time you have with your patient. So contacting us for information, there's Freedom from Smoking. Again, that is you can use it as a community clinic or within your own provider organization. There are Cessation TA. There's an email address and there's a listserv. Those are both in conjunction with 2 CDC grants, mine and another, that we are now offering to anyone. So you can send an email to the Cessation TA or the support at Cessation and ask to be on the listserv or ask for any questions you might have. So I want to know that you are making a difference. I do know how hard this work is. I appreciate your time. And I'm now going to try to see what we can do to help you with more resources going forward. So you may or may not know about the Million Hearts Tobacco Cessation Change Package. There is a cardiovascular Million Hearts, and again, a change package. The difference is that a change package is not in and of itself a toolkit. It may include toolkits, this one certainly does, but it also offers a lot of information as far as how to implement a health systems change for implementing tobacco treatment protocols into the clinical setting. The best way to get to this is to go to this website here. It is Health and Human Services, because that's where the CDC rests. And if you click on this, you'll get to a couple of pages. It'll explain what the difference of a change package is. I know this is maybe a little blurry, but it will show you, I just wanted to show you all the different types of resources that are included in this. And this is real world work. These are tobacco control programs. These are medical centers. These are hospitals. We've got a little bit of everything in here. And so I want you to know, wherever you're at in your journey with this work, you can find a resource and some support in moving along your progress. So the change package has these, really, once we get through the introductory work, we get into key foundations, equipping care teams, screening, treatment, referral, and follow-up. So the key foundations and equipping care teams, that's what's getting into organizational change. So if you are a part of this journey or being asked to try to put something together, or you're already on one of these care teams, that's what this is all about here. and would be a different, a completely different webinar for right now. So I would like to spend some time in the screening, treatment, referral, and follow-up. So in order to do this, I'm going to go live into my Million Hearts document, which is not that. Where did it go? Here it is. Because can everybody see this? Okay, I'll take that as a yes. So I wanted you to be able to see what this looks like live. It will make it a little clunky. And I apologize for that, but I thought this was the best way for me to be able to share what is in this change package. So we have our information down here as far as hospital setting, behavioral health, or clinic. Many can be used in all of these areas. I am going to skip, so we have this nice bookmark over here. I'm going to skip the key foundations and the equipping care teams and go directly to screening. And I'm not going to go live to this because it doesn't like it. It goes because we're going to an internet site. So now I'm going to go to, see if this works. If you click on that, I think I've got it, you'll find this. So this is out of University of Wisconsin. They've done a lot of great work, and they have a ton of offerings within this resource guide. This is page 10. So you may be comfortable at understanding a workflow like this. You might have seen it. IT folks really like these kinds of things so that they can get the workflow correct. But it's a great way to build certain things into, and in this case, we're talking Quitline referrals into the EHR. So I do understand that this is in the works. I hope I'm not saying anything out of turn. Taylor will fix it for me if I am. But what we want to be able to do is do some sort of an e-fax over to your Quitline. So depending on how all of that is going to work, if you build it in, there's a better chance of having this happen. So I know everybody hates all these buttons and clicks, but when you click something in an EHR, that means something will happen. So these are I click this, I click this, I click this, it's gonna move along, it's gonna move along. But it's also the only way to count anything for quality assurance purposes. So I know that it gets a little frustrating, but keeping in that mind, you want to be able to track the fact that you did refer someone to the Quitline. Okay, so let's go back to uh-oh. Sorry about that. I knew this was going to happen. Please bear with me. I'm back to the change package now. It won't be clunky like this for you. What'll happen is you can actually click on these links. They'll open directly into your browser, and you can take a look and do whatever you want to with them. You can say this is helpful, this is not helpful, and do some more scrolling if you want. But I do want you to know that these resources go directly to where you want to go. So this is out of New York City, Department of Health. And this is a coaching guide. Now, some of you may have seen this before, and I'm going to pull this up for you. I'm not going to click because that doesn't work. Let me find it. And I'm going to share this. Okay, so here's an example of a guide within the guide, but that's why they call it a change package and not a guide, although I have a tendency to say guide sometimes. So this may or may not be something that is helpful for you, but we can scroll in again. We get to the ask, all of these great questions. What's neat about this one is it actually gives you some scripts. So for people who may need a little bit more training, or if you're even feeling it within yourselves that there's some pieces of this that you're not comfortable with, this might help you. The clicking goes along again, it's got questions in there. If you don't have those types of parameters in your ask, that's something that could increase or improve your efforts throughout the organization. And again, here's your advise, and so on. Okay, so we're going to go back to the change package. I only have a few more of these, bear with me. Don't want to do too many of these. Okay, so that's the screening part. Let's get into treatment. So this one from the AAFP, going to do down here, and it's Office Champions for Tobacco Cessation, that's in the way, obviously, with behavioral health facts. So interesting, this is where we can find a lot of data, information, resources to help with all those challenges, or what I frankly call a barrier to doing this work within the behavioral health community. There are so many misconceptions out there, you know, that those suffering from mental illness can't quit, those in recovery don't want to quit because they only want to recover from their substance use disorder, those kinds of things. And this will speak to you on that. So need to read all of this. Challenges of quitting. So second one down, cigarette smoking appears to be an attempt to self-medicate or cope with symptoms of depression, anxiety, boredom, loneliness, et cetera, Smokers often report that cigarettes improve their mood, anxiety. However, research studies of cognitive functioning show that non-smokers outperform smokers in nearly all tasks, and the benefits of smoking seem to be restricted to modest increases in attention during simple repetitive tasks. So the next paragraph expounds on this a little bit more because it talks about, again, those moods and how smoking makes people feel better, but maybe it's just the alleviation of their withdrawal symptoms. Now, nicotine only has a very short half-life in the body. So every 2 to 4 hours, depending on how heavily their nicotine addiction is, they're starting to go through these withdrawal symptoms, which are anxiety, sadness, agitation, so on and so forth. So the cigarette is then taking care of that withdrawal symptom. So there's a lot in here sort of to beef that up if you need this within an organization to help move something along, to help other clinicians within your team. I know there's a lot more cross-pollination now between behavioral health and behavioral health and medical health, and that these providers are now starting to populate both worlds because the co-occurring disorders are strong in this world. Okay, so I am just going to go to, let me look at the time. Okay, so back to this cessation change package. I'll just do it this way. Doesn't seem to want to work for me. Please bear with me. Okay. Let me try this. Uh-oh. I think I did something. Let me try this again. I hope we're back. Okay. And I will skip the last one because I know that there might be questions, but I was going to share with you a motivational interviewing and scripts. So the thing about motivational interviewing, and this gets into counseling and medical providers, that is just not something I know that is usually sort of in your comfort wagon. We sometimes try to call it coaching, maybe that'll work. But I do believe if everyone took a look at this motivational interviewing script, it might help you pick and choose some things to use with patients that are just there for their annual visit. You don't have a lot of time. You don't want to get into the, I don't want to quit, don't talk to me about smoking, don't do this, don't do that, all the challenges that some of our patients give to you. This may help with some of those tools that might alleviate some of that back and forth and give you maybe one technique that you would use. You don't have a lot of time, but you would use this technique to help move someone along. The other arena, of course, where this is very important is those of you in the behavioral health world, you know how to do motivational interviewing, and you understand change, stages of change and all of that, all that's needed to support you in your work, and I'm not minimizing that all. So one of the things to help support your work in this is how do you put the tobacco language into the motivational and change language, and this will help you do that. So I'm not doing any more of that back and forth for right now. What I will be doing is I just wanted to show you in the appendices that are in here as well. So there's some quality improvement information. This goes more with if you're trying to expand for the whole organization and you need high level commitment and you need the COO and the CQI and everybody else involved in this conversation. This is just the beginning of a conversation for quality improvement. And tobacco fits in there quite nicely, actually. So Appendix B, now I need to go back here so you can see it. I just wanted to show you, this is a different way to use it. So if you're saying, well, geez, I don't know where I want to go, I really need to just see some screenshots because even though there are some epic screenshots within here, there are a lot of other types of ideas of screenshots that you can use. And so you might just want to take a look at screenshots. There are case studies. And for every section, there are more and more case studies. So that is what I was going to do for the sharing. And I am supposed to get out of sharing and move it over to Taylor. Okay, in the wrong place. Sorry, I forgot where this is. Are we on?
We're on. We're good. Good
Okay.
afternoon, everyone. My name is Taylor Wren, and I am the Cessation Coordinator for the Tobacco Cessation and Prevention Program within Well Ahead, Louisiana. Today, I'll be discussing the tobacco cessation resources available to Louisiana residents and healthcare providers. The next slide will give you a specific breakdown of the topics that will be covered. Today, I will be focusing on three main topics. First, cessation resources available in Louisiana, cessation resources for youth, and finally, we'll cover available healthcare provider resources. So let's start with Louisiana cessation resources. The Louisiana Tobacco Quitline provides free, evidence-based telephone and web-based cessation services. Sorry guys, 1 second. This one. Yeah. Okay, sorry guys. The Louisiana Tobacco Quitline provides evidence-based telephone and web-based services to all Louisiana residents ages 13 and up. To ensure effectiveness, the Quitline uses 4 key approaches to better serve all types of tobacco users in our state. These include 5 telephone-based behavioral coaching sessions with a trained quit coach, the delivery of medication support through nicotine replacement therapy. Each eligible caller will receive a 2-week supply of nicotine patches or gum. Text message and web-based counseling is also offered through the Quitline. Participants have the option to utilize these services in integration with the phone-based Quitline program or as a standalone service. A 2-week supply of nicotine replacement therapy is also available to those enrolled into the web and text services. Callers will also receive self-help materials, including a personalized quit plan, referrals to community-based resources, and coordination with health plan and employer benefits. These approaches result in a successful phone quit rate of 31.4% and caller satisfaction rate of 91%. So in 2011, a class action lawsuit ordered tobacco companies to fund a smoking cessation program to benefit eligible Louisiana smokers. The funds from this court order were used to create the Smoking Cessation Trust, or SCT. If you're a Louisiana resident and you smoked your first cigarette prior to September 1st, 1988, you're part of the Scott class and eligible for the following cessation services at no cost. So that includes cessation medications, individual and group cessation counseling, and telephone Quitline support. Participants can be reimbursed for cessation medications at specially contracted Smoking Cessation Trust pharmacies. SCT also has a provider network. So the Smoking Cessation Trust is contracting with healthcare providers and health systems across the state of Louisiana to deliver high quality smoking cessation services. So when a Smoking Cessation Trust eligible participant visits a contracted SCT provider for services, the provider will then bill the Smoking Cessation Trust directly, which in other words, the provider will have no upfront costs. Additionally, the Louisiana Tobacco Quitline and the Smoking Cessation Trust do have bidirectional referral capabilities. So SCT eligible callers who call into the Quitline and are eligible for Smoking Cessation Trust services will then be transferred directly to the trust if they give consent to receive further treatment options.
Support line numbers and SCT website link are located on the Quit With Us LA website and have also been provided at a link at the end of this presentation. Quit With Us Louisiana is our statewide cessation brand. It's essentially the forefront of 1-800-QUIT-NOW or the Louisiana Tobacco Quitline. The website quitwithusla.org includes quit resources for both those seeking to quit tobacco as well as those wanting to help our residents quit. Quit With Us LA provides links for both residents and providers to access the benefits of quitting, web enrollment into the Louisiana Tobacco Quitline, and the support line numbers for both the Louisiana Tobacco Quitline and the Smoking Cessation Trust. The website houses cessation-related provider resources such as healthcare provider trainings, promotional materials, and downloadable fact sheets, which I'll go a little bit more into later on in the presentation. Quitwithusla.org also offers information on our statewide cessation partners who play a vital role in cessation. It also addresses what their roles are and how they can best address the community's needs. The Quit With Us LA website is currently undergoing a complete website refresher, so be on the lookout for a brand new website and promotional materials coming soon. Wellhead has developed a community resource guide that allows you to find local resources for tobacco cessation and other topics like diabetes, healthy eating, physical fitness, and stress management. More specifically, the community resource guide outlines community-based resources related to tobacco cessation. The guide is able to provide resource specifics such as program costs, physical address, website link, a detailed program description, and contact information such as phone numbers and direct contact names. Again, a link for this resource has been added at the end of this presentation. Next, let's take a look at cessation resources for youth in Louisiana. Connecting youth and young adults to tobacco quit resources is extremely important and a vital step in creating and sustaining tobacco-free environments. The National Cancer Institute's Smokefree Teen is a mobile-based tobacco intervention for 13 to 17-year-old tobacco users interested in or actively trying to quit tobacco. Smokefree Teen addresses key barriers and motivators for youth to quit tobacco use of all types and provides evidence-based cessation resources and interventions to help youth initiate and sustain a quit attempt. So Smokefree Teen offers several tools and tips to help youth quit. The resources include a youth-focused app, which is called Quit Start, text service, which is called Smokefree Text, and e-cigarette and vape-specific content on their website. The e-cigarette and vape-specific content includes how to deal with quitting vaping, how to deal with cravings, understanding triggers, vaping and nicotine withdrawal symptoms, and dealing with anxiety and stress with vaping. So another great resource is the Youth Support Program through the Louisiana Tobacco Quitline. The Youth Support Program is a behavioral support service tailored to fit the needs and the unique challenges that are faced by youth tobacco users. Youth callers will receive 10 interactive telephone or web-based coaching sessions, and all calls will be completed with the same quit coach who is trained specifically in youth support. As e-cigarette and vape use continues to rise, not only in the nation, but in Louisiana, Wellhead's tobacco team is currently working with our Quitline vendor to explore the development of an e-cigarette vape-specific web app or text-based programs specifically for youth e-cigarette and vape users within our state. And again, a link will be provided at the end of this presentation for this resource. In this section, we will talk through the available healthcare provider resources in Louisiana. Healthcare providers and health systems play a key role in identifying tobacco users and providing care to help them quit. Our tobacco team aims to ensure that tobacco users are screened for tobacco use, advised to quit, and referred to cessation resources. The Brief Tobacco Intervention online provider training prepares providers to intervene with patients who use tobacco by delivering the Brief Tobacco Intervention, which is a counseling component or a form of motivational interviewing that offers providers a step-by-step instructions to determine a patient's readiness to quit tobacco It offers communication techniques to effectively intervene with tobacco users, while also connecting patients to available cessation resources, which we outlined earlier in the presentation. This training also provides continuing medical education credits to a variety of providers. And just to give you guys some reach numbers, as of December 2020, we've had 178 providers trained through the VTI training, and 78 of those receiving continuing education credits. This training can be found on both the Well Ahead and Quit With Us LA websites, which are linked later on in this presentation. Fax-To-Quit Louisiana is an avenue for healthcare providers to connect tobacco users directly to the Louisiana Tobacco Quitline. Fax-To-Quit provides an easy counseling component to patients who are ready to quit tobacco. To become a certified Fax-To-Quit provider, a provider would simply complete the training module, which is available at quitwithusla.org. The presentation takes about 15 minutes and then will be followed by a short quiz. So the Fax-To-Quit process includes the provider will screen for tobacco use and assess the tobacco user's readiness to quit. The provider will then fax the form into the Quitline. A referral is processed and a call is placed to the patient within 24 to 48 hours to begin their treatment with the Quitline. And then from there, the provider or clinic will be sent a biweekly outcome report on the patient's progress through treatment. Overall, with the Fax-To-Quit program, the tobacco users no longer have to take the first step in calling into the Quitline. In our state fiscal year 2019, there were over 1,000 referrals made to the Quitline by healthcare providers through the Fax-To-Quit program. The CDC also houses a variety of additional resources for healthcare providers. So these include, on Thursday, January 23rd, 2020, the Surgeon General released its report on smoking cessation. The report highlights the latest scientific evidence on the health benefits of quitting smoking, as well as proven treatments and strategies to help people successfully quit. The report also highlights the use of e-cigarettes and the roles of health systems, providers, and payers in smoking cessation. And as Dee Dee also mentioned, the clinical practice guideline for treating tobacco use and dependence was designed specifically to assist providers, also smoking cessation specialists and healthcare administrators in identifying and addressing tobacco users and delivering effective tobacco dependence interventions. And lastly, CDC's Office on Smoking and Health, or as we call OSH, is the lead federal agency for comprehensive tobacco prevention and control. OSH offers additional resources for healthcare providers related to tobacco cessation, including clinical resources, toolkits, and fact sheets on best practices for preventing the initiation and treating tobacco use. Links to all of these resources mentioned here can be found on the next slide. So on this slide, which will be shared with everybody on the webinar, are some helpful links connecting you to valuable resources that have been mentioned throughout this presentation.
Thank you so much, Taylor, and also Dee Dee. You've given us some really valuable information that will help our providers decrease our tobacco use rates across the state. So we really thank you for sharing all your expertise. We now have time for questions from our audience. So if anyone does have questions, please type it in your chat box and we can address those. I'll give you a few minutes to type your questions. And just as a reminder, an email will be sent out following this presentation with a link to the recording of the webinar and also all the materials that were presented to you today. So you will have all of this available to you. I don't see any questions coming in, but I will give you the contact information for either Dee Dee or Taylor. If you have any questions that come up after the presentation or you think of anything following the close of the presentation. I want to thank you all for joining us today. Be on the lookout for the next Walpen email for any upcoming webinars and trainings available. Just thank you again, and everyone have a great day.
Thank you.